guys, I just came from the trauma bay. They're getting 3 traumas from the tent, so they want us all down there.
My favorite part of this program is just the residents. They're just a great group of individuals. They're great physicians. They're fun to work with. They really just take care of each other, and they make my job as the program director really fun.
The culture of this program starts at the top.
As residents, we feel like our voice is heard, and that is because of Dr. Preston.
Hey, Dr. Preston. I just saw our patient.
Okay.
So he's a 50-year-old guy, otherwise healthy.
Resident progression and maturing, as I call it, is one of my favorite things about being a program director. To see them come in as interns who really have a good foundation of medical knowledge, but really don't know how to take care of patients yet, and see them at that level progress to their chief level, where I'm graduating them and they're moving on to practice or fellowship. It's one of the best things that I get to see.
What stands out here is that the residents in their 5th year, they are ready. You can tell that sometimes even as early as their 4th years, that they're operating at the level of an attending.
Everybody here is invested in teaching the residents and getting them up to speed to operate and to become the best clinicians they can possibly be.
One of the things I just came back from was doing a 3-month elective with SpaceX, which was awesome. When I was interviewing, I was looking for a program that would help me build my career around my specific interests in surgery.
Our culture is really team focused, and our attendings enjoy working with even our medical students and our interns.
Yeah, whatever your procedure hand is, you want to minimize.
I'm 2 months into my intern year, so I think the most important thing that I could ask for is that everyone has been super supportive.
It's funny when you look back on the years that have gone by, you see how much you've grown, especially when you see a second-year resident or an intern approach you regarding a question.
What is your plan for her?
So plan for her, we talked about going home today. She's tolerating a regular diet. She's able to get up and walk. And her pain is pretty well controlled on oral medications. So I think she'll go home today and follow up with us in a couple weeks.
Okay.
The experience is diverse. Our residents really get to see different clinical settings, different practice types, different patient populations. You know, they rotate at the University Medical Center, they rotate at the VA Medical Center and work with the veterans. They rotate at our one of our community hospitals, Desert, and they see a urban general surgery practice. And then they rotate in Alaska at the Alaska Native Medical Center, and they get to take care of the Native population there. And that practice is really reflective of what a rural surgery practice is. And so I think their experience in all those areas allows them to see unique pathology, take care of unique patients, but also try and figure out what fits their personality best.
I got to start on transplant, which means that I got to take some private jets to different cities to do procurements. We went to Dallas, Tucson, and a few other places.
I was doing appendectomies with my attendings as an intern.
Our OR2 at the VA, where it's small lumps and bumps, but you feel like that's the first time you're the surgeon in the OR. You really kind of grow out of your shell at that point.
The attendings tell you, this is your service, you tell me what you want to do, and as long as we're safe, we're going to do it. And so that kind of confidence and trust is something that is built over the 5 years of this program, but everyone who earns it gets it.
One of the unique things about our program is our robotics training curriculum.
So every resident that comes out of this program is going to be certified to operate robotically. Additional training will not be needed. They will be cleared and they would have completed all the necessary surgery.
And we've seen the robotic service lines grow from general surgery to colorectal to bariatrics, thoracic, and now hepatobiliary.
Additionally, we have a newly developed ultrasound curriculum where our interns start with simulation and ultrasound and develop those skills as they move throughout the entire program.
What I would say about this program in particular is that the residents prioritize taking care of each other. They watch out for each other, they teach each other, they help each other. There's really no undercutting the next guy to look good.
Our goal is to build an environment where everyone is included and everyone gets a chance to operate and grow as surgeons and as clinicians.
Any program you go to, it's going to be busy, it's going to be hard, but you're going to be able to find relief and find sanity in your co-residents and your mentors.
All right, guys. Next goal gets a day off. Oh! The med student gets a day off? No way.
I think another highlight of our program is our history. Harlan Stone was our program director and chief of surgery for many years, and he is a well-known name in trauma and general surgery.
We have multiple attendings who are graduates who have chosen to continue to train future residents and future surgeons within our program, and I think that is something that speaks to our culture immensely.
We have a really diverse residency and a diverse faculty. It's not very common you find so many women surgeons on faculty, and we're almost even in our women faculty compared to our men. And I think that provides a really nice training environment for our residents.
I love Arizona.
Phoenix is a great city to live in.
It's just beautiful weather 9 months out of the year. There's so many things you can drive to within 2 to 5 hours.
We've actually gone up to Flagstaff and Sedona and gone on a few camping adventures out there as well.
Phoenix is 5 hours from LA, 4 hours from Vegas. It's young, it's growing, people are outdoorsy, and you can take advantage of all the different landscapes in Arizona.